an example of what we're discussing on the course is airway management, and in particular, as you all are aware, with airway management you can do endotracheal intubation, or if you don't do that, up till recently the only option a general practitioner had was to use an oral airway, and everybody was aware of the problems with oral airways in the lack of protection they actually afford. Yet the use of an endotracheal tube, if you're not using it every day, presents you with real difficulty if you get it wrong. Consequently, over the last 20 years, a number of technical innovations in airway management have come to the fore, and they initially started with the laryngeal mask airway, and that has now morphed into a second and third generation device, and in this particular case, the iGel. The advantage of the iGel is it is a simple, straightforward, easy to use piece of equipment that is very, very difficult to misplace and doesn't have the dangers associated with endotracheal intubation or other techniques that complicate airway management. And so, as an example of what I'm discussing, to place an iGel, all we need to do is to place a securing headband behind the patient's neck, select the appropriate sized iGel, which comes on its own stand, and just by simply putting a dollop of gel on the back of the stand, gelling the device on the back with a little bit on the tip on the sides, we can then place the device simply by picking it up with the distal opening away from ourselves, a gentle digital pressure on the point of the chin, and then placing the tip of the device on the hard palate and gently thrusting it. And if you're watching this, you're probably thinking that looks deceptively simple. It is deceptively simple and highly effective. It allows the medical practitioner to quickly and effectively secure an airway, to obtain around 90% of the level of protection that you would get through an endotracheal tube, and it ensures that the air leaving the ventilator enters the trachea and the lungs, and that we do not have an increased risk of gastric insufflation and regurgitation of stomach contents as a consequence. So a technique like this is a very, very useful adjunct for general practice.